Today, we will be discussing the topic of the spread of infectious diseases through medical waste. We will be covering the history of infectious medical waste, the spread of blood-borne pathogens, the contamination risks of infectious waste, the prevention of diseases from infectious medical waste, and current policies and regulations regarding medical waste. Infectious medical waste fell under the radar until the 1980s. Medical waste was being discovered on beaches and raised concerns about the spread of infectious diseases through the improper disposal of medical waste. As you can see from this photo, here is a syringe and other used medical equipment. As a result of this concern, the Medical Waste Tracking Act of 1988 was implemented. This act promoted regulations on how to properly dispose of medical waste. This act was implemented in 4 states: New York, New Jersey, Connecticut, and Rhode Island. Because of this act, which did expire in 1991, the exposure of infectious disease to the public specifically from medical waste was less likely than the exposure risk to healthcare workers. New policies and regulations that will be discussed later in this video are still being implemented and perfected, but the spread of infectious diseases from medical waste is not nearly as common as it used to be.
Because of the infectious nature of Hep C, any needles or other medical materials used on infected patients need to be disposed of properly. This helps avoid any accidental infections of healthcare workers or any other non-infected people. The incubation period for Hep C can last anywhere between 14 and 80 days, so tracking it can become very difficult. Proper waste management is crucial for preventing any accidental infections. Bloodborne pathogens are germs that are commonly found in human blood. Widely known bloodborne pathogens include HIV, hepatitis A, B, and C. Hepatitis C is a virus that targets the liver and can lead to inflammation. If left untreated, it can cause liver cancer. Hepatitis C is transferred through bodily fluids of infected people. This includes sharing personal items, giving birth, using unsanitary tattoo or piercing tools, as well as needle stick accidents.
Ouch. According to the CDC, healthcare workers suffer between 600,000 to 1 million needle stick injuries each year. While needle stick injuries are one of the most common ways to be exposed to hazardous and infectious waste, there are many other ways to be exposed. From inhaling mucous membranes of infectious waste to touching hazardous bodily tissue, not washing your hands properly, and then eating finger food, it's important to properly handle infectious waste according to regulations set by the government. Now let's talk about some of those policies and regulations to help prevent accidents.
Depending on the type of medical waste, it may need to be incinerated or go to a special disposal site for medical waste. For example, the blue bin seen on the right side would be for linens. Linens often have bodily fluids and can contain things such as C. difficile, which makes it very important that it is separated and put into its own bin. All the linens are put into blue bags, they're tied up, they're then put into a bin just for linens, and then the linen cart is saran wrapped. And we do that just to make sure that none of the waste that's inside comes out during transport. It should only be opened, and stuff should only come out once it's at the disposal site. In the United States, the first major act to control the disposal of medical waste, this act being the Medical Waste Tracking Act, this sets standards for how medical waste is to be disposed of. It ensures that records are also kept of what is being disposed of. Further, there are also procedures regarding the cleaning of equipment and how it should be completed to prevent the exposure of medical waste to humans, animals, and the
Proper disposal and procedure is key for preventing the spread of disease through infectious waste. Any instrument or materials used operating on a patient that is contagious needs to be sterilized and disposed of. Here are some of the most common EPA-approved methods of waste disposal. For any surface, bleach is a common cleaner used for disinfection. And after being used for medical waste, cleanup or treatment, items such as bandages, clothes, or disposable plastics are often incinerated to prevent contamination to other equipment or individuals. For tools and instruments used for surgery but aren't disposable, such as scalpels or other devices, They're cleaned using autoclave sterilization, a method of using machinery to heat and pressurize the medical tools to kill infectious bacteria and spores. Now that we know how to properly prevent contamination from infectious waste, we can continue to be healthier and safer as we treat patients and go about our lives.